Welcome. Today we will explore how Medicare works and how Medicare Savings Programs, or MSPs, reduce healthcare costs. Important note for everyone. Before we start, this presentation doesn't determine if someone may be eligible for Social Security disability benefits or other government services. The information presented today is general and may not include the most recent changes related to today's topic, including annual income limits. Rules and programs can also change with new laws or updates, which may not be reflected in today's presentation. We recommend that you consult directly with Social Security, a work incentive planner, or other professionals to get accurate information that best fits your personal situation. Let's get started. Medicare is a federal health insurance program run by the Centers for Medicare and Medicaid Services, or CMS. It helps cover healthcare costs for people who are 65 or older and some younger people with disabilities. Medicare has 4 parts: Part A, Part B, Part C, and Part D. More than 75 million Americans rely on Medicare. Most qualify by age, but younger people can qualify too, like Social Security Disability Insurance or SSDI recipients, though most must wait 24 months after receiving their first SSDI payment. People with certain life-threatening health conditions are automatically enrolled without the waiting period. SSDI beneficiaries automatically qualify for Medicare, but most must wait 24 months after their SSDI payments begin before coverage starts. There are exceptions to the 24-month waiting period. People with certain life-threatening health conditions qualify for Medicare immediately. SSDI payments do not start until 5 months after the disability onset date, and the 24-month Medicare waiting period begins with the first month of SSDI payment eligibility. Since disability appeals can take months or even years, some people become eligible for Medicare almost immediately after winning an appeal, since their waiting period may already have passed. We will now explore the 4 parts of Medicare. Medicare Part A is automatic for SSDI beneficiaries, and they do not pay a premium for it. However, they may have to pay deductibles and co-payments. Part A covers inpatient hospital care, limited skilled nursing facility care, home health services following hospitalization, and hospice care. Medicare Part B is optional, but most enroll in it. They must pay a monthly premium, which usually increases each year. Part B covers doctor visits, mental health care, vaccinations, durable medical equipment, prosthetic and orthotic devices, and home health services. After the annual deductible, Part B covers 80% of approved costs, and beneficiaries pay 20%. Medicare Part C, or Medicare Advantage plans, are run by private insurance companies. These plans provide services not covered by traditional Medicare, such as hearing aids. About 40% of beneficiaries are enrolled in a Medicare Advantage plan. Some plans include only Parts A and B, while others also include Part D. Medicare Part D covers prescription drugs and is run by private health insurance plans. It has monthly premiums, co-payments, and deductibles. Costs may be reduced if you qualify for the Extra Help program, also known as the Part D Low Income Subsidy or LIS program. If you delay enrolling in Medicare Parts B or D when first eligible, you may face penalties unless you qualify for an exception. The Part B penalty increases your premium by 1% per month of delay, capped at 10% per year. The Part D penalty is a premium increase for each month of delay. Exceptions include having health insurance through an employer or other creditable coverage. Enrolling in a Medicare Savings Program, or MSP, can eliminate these penalties. Many people can work without losing SSDI if they earn below Substantial Gainful Activity, or SGA level. In these cases, Medicare coverage continues if SSDI payments continue. When your countable earnings exceed the SGA limit, SSDI payments are first suspended and then terminated. At that point, the Extended Period of Medicare Coverage, or EPMC, ensures you can keep Medicare benefits for at least 93 months. about 7.5 years following the end of your trial work period, or TWP. Note, the EPMC is only available if you continue to meet Social Security's definition of medical disability. Some people are eligible for both Medicaid and Medicare. For dually eligible people, Medicare is the first payer for services covered by both programs, with Medicaid available to pay any uncovered expenses. Medi-Cal, called Medicaid outside of California, often covers services that traditional Medicare does not, such as long-term care in nursing homes, dental care, and vision care. Part C plans are often not cost-effective for many who are dually eligible. Medicare Savings Programs, or MSPs, are administered by state Medicaid programs under federal rules. These programs help pay for Medicare costs for eligible beneficiaries. The Qualified Medicare Beneficiary, or QMB program, pays Part B premiums and Parts A and B deductibles and copayments. The Specified Low-Income Beneficiary, or SLMB program, pays Part B premiums. The Qualified Individual, or QI program, also pays Part B premiums. Qualified Disabled and Working Individual, or QDWI program, pays Part A premiums for eligible beneficiaries who have exhausted their EPMC. The Qualified Medicare Beneficiary, or QMB program, helps pay for Medicare costs for eligible beneficiaries. The QMB program pays the Part B premium and Parts A and B deductibles and coinsurance. To be eligible, you must have Medicare Part A and meet countable income and countable resource limits. The Specified Low-Income Beneficiary, or SLMB program, helps pay for Medicare Part B premiums for eligible beneficiaries. To be eligible, you must have Medicare Part A and meet countable income and countable resource limits. The SLMB program does not cover deductibles and copayments for Parts A and B. The Qualified Individual, or QI program, helps pay for Medicare Part B premiums for eligible beneficiaries. Eligibility requires Medicare Part A and meeting countable income and countable resource limits. You cannot qualify for both Medi-Cal and QI at the same time. Federal funds for QI are limited, so eligible beneficiaries are encouraged to apply early. Normally, if someone does not sign up for Medicare Part B when first eligible, they get a penalty, 1% per month of delay. There are two main exceptions. If you had creditable coverage from an employer's health insurance plan, either your own or your spouse's, during the time you delayed enrollment, or if you later enroll in a Medicare Savings Program, or MSP. In both cases, the penalty is removed, regardless of how long the delay lasted. The Medicare Part D prescription drug program can create significant out-of-pocket expenses, such as monthly premiums, prescription copayments, and a coverage gap, or donut hole. The Extra Help program, also known as the Low Income Subsidy, or LIS, can help cover these costs. There are two ways to qualify for Extra Help: meeting income and asset tests, or being dually eligible for Medicare and Medicaid. People enrolled in an MSP automatically qualify for Extra Help. In review, Medicare has 4 parts, A through D, covering different healthcare needs. SSDI beneficiaries typically qualify after a 24-month wait. Working below the SGA level means you can keep both SSDI and Medicare. If you go over SGA, the EPMC allows you to keep Medicare for at least 93 months if you remain medically disabled. Dual eligibility with Medicaid gives you access to services Medicare doesn't cover, and Medicare Savings Programs can help pay costs like premiums and copayments. Enrolling in an MSP not only removes the Part B late enrollment penalty, but also guarantees extra help for prescription drug costs, even if you wouldn't normally qualify. These programs help you lower costs and keep your healthcare coverage while staying independent. With these tools and protections in place, you can navigate Medicare with confidence and maintain the healthcare coverage you rely on. Thank you for joining us today. Now that we have covered how Medicare works and the programs that can lower your costs, We hope you feel more confident about your healthcare options, when coverage starts, and how to protect benefits while working. In our next session, we will look at Medicaid buy-in as another option to help you keep healthcare coverage while working. If this is your first time viewing one of these sessions, go to the California DOR website at www.dor.ca.gov and click on the Programs for Social Security Beneficiaries link, and then click on the Benefits to Independence 101 link to begin the program. You have now finished Session 18 of Module 3 in the Department of Rehabilitation Benefits to Independence 101 program. Before you go on to Session 19, please go back to Benefits to Independence 101 Module 3, Session 18 page to do the activities and look at all the resources we talked about in this session. We are happy to continue this journey with you in Session 19 as we build on what you learned today.